Hi everyone. There goes a saying that have the courage to accept the things that you cannot change. Have the courage to change the things that you can. The theme of this year's World Kidney Day is living well with kidney disease. When a disease as major as some kidney disorders set in the system, it becomes very important that the patient should learn how he can live and manage with the condition that he has. Because if we consider a disease called as chronic kidney disease, which is a progressive condition, all that a patient can do is learn to live with it and manage it with various lifestyle modification techniques and his medications so that the progression of the disease can be slowed down and possibly even bring about an improvement in his condition. Now, a patient having chronic kidney disease will be asked to restrict certain kinds of foods or foods that are rich in certain components. And it is very well known that they are usually asked to cut down on their salt intake, protein intake, phosphorus, foods that are rich in phosphorus, and potassium. Basically, because the kidney functions are deteriorating, and if the person takes foods which are rich in these components, it becomes really very hard for the kidneys to filter them out, eventually leading to electrolyte imbalance, loss of protein in the urine, etc. So these are well known facts. These are very well established ways of management, and they are advised for the patients and they are asked to follow it. But now let us look at some lesser known but very interesting facts. That is, use of prebiotics and probiotics for the management of CKD. First, let us try to understand what are prebiotics and probiotics. Now, if you consider your gut or your gastrointestinal system, it harbors numerous microorganisms. In a normal adult, healthy adult, the proportion of good bacteria are way higher than that of the bad ones. So when we use the term probiotics, we are referring to the good bacteria. Now, what do these good bacteria do? They adhere to various spots in the intestine and they compete with the bad bacteria, meaning they don't allow them to adhere and harm us. So, these probiotics are very useful to us in numerous ways. These probiotics need something to thrive on, and those substances are called as prebiotics. Basically, these are indigestible fibers which the probiotics can use, and they basically use it for their survival. And these prebiotics selectively help the probiotics only and not the bad bacteria. So, where do we get this probiotics from? It's simple. We get it from yogurt, we get it from buttermilk, etc. Prebiotics, as I told, these are fibers. So they are available in wide range of food products like onions, garlics, some fruits, greens, etc. But what is the connection between probiotics, prebiotics, and kidney disease? Let us try to understand that. A person having chronic kidney disease shows an elevated serum levels of various components like creatinine, urea, etc. because the kidneys are not able to filter them out. And not just that, a lot of other end metabolites also are high in their blood. So when the urea concentration shoots up, it fuels those bacterial strains in the gut which are able to metabolize the urea and produce harmful uremic toxins. So now we are talking of the bad bacteria. And these uremic toxins, finally, they alter the intestinal integrity and induce inflammation. They are capable of inducing inflammation in various parts of the body. If we see chronic kidney disease patients, they also complain of poor appetite, indigestion, and other digestive complaints. This could also be contributing to that. Not just this, the high level of urea and the uremic toxins that are produced by these bad bacterial strains, they also cause a reduction in those bacterial strains in the gut, which have an anti inflammatory effect, meaning the good bacteria. So now, actually, what is happening is a fight between the good and the bad bacteria. How can we correct it? One simple way is by giving supplementation of good bacteria or the probiotics so that we help their colonization and eventually we help them to replace the bad or the pathogenic bacteria. These are the research papers from which I am quoting all the things. I am going to share the links of these research papers in the description box below. I would recommend all of you to go through it. These are all, most of them are recent studies which give us information about the connection between the gut microbiome and the kidney health, or in other words, the chronic kidney disease. This is another paper, a research study that gives us information about the role of the gut microflora and the therapies involving probiotics and prebiotics in managing the chronic kidney disease and the condition of uremia, that is, an increase of the levels of urea in the blood. So, finally, just a small parting note. Managing the kidney disease is okay, but there is nothing better than preventing it. So we can definitely help keep our kidneys happy and healthy by following a very few simple measures like drinking ample amount of water every day. Watch out for the color of your urine. If it is dark yellow in color, it means that you're not hydrating your system enough. Drink more water. Not just that, be sensitive to how your mouth feels. If your mouth feels dry, it can be a subtle signal that your body is giving that you need to water your system more. So let us strive towards preventing the kidney diseases in the first place. And not just that, also learn effective measures, effective lifestyle measures of managing the same condition. Thank you for watching.